This week we're talking about Achilles tendonitis and ruptures and how to manage those, but first, our disclaimer. Dr. Mike Matthews, physical therapist here with the PT411. Thanks so much for joining me. If you already haven't done so, make sure you follow, like, subscribe, Facebook, YouTube, Instagram, TikTok, and Twitter. Also, make sure you check out thept411.com. So like I said, this week we're talking about the Achilles tendon. We're talking about tendonitis and ruptures. Those are pretty closely related because pretty much what happens is that tendon takes a little bit more force, whether it's a small repetitive motion that builds up, or if it's one high velocity, one big impact or big stretch, or really just one major overload on that tendon, it will fail, it will get injured. It's much less likely to get ruptured or injured compared to other tendons in the body. It's very, very thick and very, very strong, and it is designed to hold much more than our own body weight. But like I said, it can and it does get injured. So I'm gonna go off on a story that I heard during PT school, and I heard quite often actually after PT school during postgraduate trainings, and I'm really condensing it here. But basically it goes that there were a couple of surgeons that worked in the same clinic that both specialized in these Achilles tendon ruptures, on repairing them actually. So one of them actually at some point in time while he was working out, he ruptured his. It was a pretty small rupture. So he goes to his colleague and asks his colleague, go ahead and fix this for me. I'll go through the rehab. I'll do blah, 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 blah. But his coworker, his colleague, the other surgeon looked at it and said, you know what, this is too small. This isn't something that I feel comfortable with actually doing. If it was worse, yeah, I would go ahead and do it for you. But I got to treat you as I'm treating everybody else that walks in this clinic that I would see like this. We're going to try to let it heal on its own. So what that surgeon actually ended up trying to do is he tried very actively to make it worse because he just wanted to get it repaired. So he would overload that tendon. He would try to put as much pressure, as much force throughout that ankle as he could. He started off with doing heel raises, trying to drop it off of a step. Over time, he noticed, hey, this actually isn't hurting as bad. I'm going to put more force. I'm going to put more pressure through this. So he'd stand on the edge of there and he would really drop his heels down bad. He'd really try to drop them down really hard, really trying to injure it further. Over time, it wasn't hurting as bad. So he started running on it. He started sprinting on it. He started jumping on it. And eventually that wasn't hurting as bad. Before he knew it, he really wasn't having very many symptoms at all. And if he was having symptoms, they were very, very minor. So he decided to fess up to his colleague to see what was going on. So they did a repeat MRI, and what they saw was it was healing at a much quicker rate than they would expect if they would have just let it rest. So these surgeons, what they actually did is they started applying these to a lot of their patients, and they saw that a lot of patients, even ones that were more severe that they thought that they were going to need to actually do surgery on, they were actually healing by doing this process. They weren't being as aggressive as that surgeon was with his ankle, but they did try to slowly progress things along, and they kind of fine-tuned it and started listening to their symptoms, and based off of their results, a lot of other people actually started doing the same thing. Researchers went through it and they actually found out through a lot of research, a lot of scientific studies, a lot of peer-reviewed studies at that actually as we load up tendons, they actually start to get better. We have to load them up slowly and progressively, but it shows that things can actually start to get quite a bit better just by loading an injured tendon appropriately. Now, if you've seen any of my previous tendonitis videos, you would have already guessed that we're going to load this Achilles tendon. That's what I've preached in all these other videos. We've got to load it. Now we have to watch out for our Goldilocks zone. When we're treating this, we have to listen to our symptoms. There's a Goldilocks zone in there where we're doing just the right amount to actually facilitate the healing process. We're not doing too little, that we're not seeing any improvements, that we're not stressing it out enough. We're not actually doing so much that we're actually keeping it perpetually injured either. We've got to find that zone right in the middle, because all too often people get this injury, they just rest and rest and rest, then they try to get back in to to whatever their activity level is, and it's still injured, it's not any better. And so listening to our symptoms when we're loading this, every single time we're loading this, it needs to be uncomfortable, it needs to be painful, not severe pain, just mild, moderate amount of pain. And when we're done with our activity, it needs to linger for a little bit, no longer than 5 minutes. If it lingers longer than 5 minutes or it's very severe while we're doing it, we need to back off. But if our pain is very minor and we don't have anything lingering afterwards, we're not doing enough, we have to increase it, we have to advance our load to make sure we're staying within that right zone, that Goldilocks zone. So make sure you keep that in mind as you're progressing through these exercises. We're going to start off with the simplest, the lowest load that we can put on this, more of a stretch. Then we're going to slowly work towards strengthening it and putting more and more pressure on it. No two people are going to start off in the same spot. We have to fart around with it a little bit. Some people might have to start off being very, very conservative with it, while other people can get pretty aggressive with it pretty quickly. We just got to listen to those symptoms. And as our symptoms tell us, we got to progress it along these exercises that I'm showing you. So the first thing that we have to do is actually stretch out that tendon. We got to stretch out that calf muscle. Oh, actually, we got to stretch out a couple different calf muscles there. So we're going to start off by sitting down, and we're going to get a strap here, something that actually isn't movable, something that's nice and tough that we're going to put up close to the ball of our foot here. We're going to start off with our knees straight on this first one. We're just pulling back to get that stretch in the back here. For our stretches, we're going to hold for 30 seconds 3 times. We're doing this 3 different times a day. Not only are we doing this with our knees straight, we're going to do this with our knee bent as well. When our symptoms tell us to progress things further, we're actually going to get one of our resistance bands here, put it in the same spot, legs straight, working on pressing straight down. The good thing about these is these are real easy. We can choke up, put more tension on it, or we can get a band that's even stronger. Looking for that Goldilocks zone. 30 repetitions, 3 different times each day. When it's time to progress that on further, we're going to have a seat, feet flat on the ground. We're going to put pressure on top of that knee. We can start off with just a little bit of our body weight, of our upper body weight, pressing up and down. Going here, same thing, 30 times, 3 times a day. Progressing it further by putting even more weight through it. That's getting easier, but it's not quite time to stand up. Standing is still a little difficult. We grab some weight and put our weight through it, pressing up and down, right there. Once we're maxing out there, both with weight and our bone body weight, we got to start by standing up now. And we're working on heel raises, using both sides, using the weight of our body. Same thing, 30 repetitions, 3 times a day. When it's time to progress from there, we need to grab our step. Make sure I'm staying in frame here. And we're going to have our feet, our heels off the edge here. We're going to lower down past to get a good stretch before we come up this way. I'll show you from the side how that looks. Or going down off the edge, and you're raising all the way up. Good full contraction up at the top. 30 repetitions, 3 times a day. When it's time to progress that, you're going to take that one foot off, and you're doing this with one foot only. You may need to even grab something, hold on to a stick or something in front of you, or even a counter to work on this. Just working on that one foot there. I also actually switch sides so you can see what I'm doing here. Going up and down, full body weight going through that one foot instead of both feet. Now to progress this even further, once our symptoms tell us it's time to go further, we're going to go back to both feet, but now we're going to start off at a neutral spot here. We're going to drop as quickly as we can, or as quickly as we are comfortable with, rather. Just going to drop down, you're going to raise all the way back up, lower down slowly to that neutral point, drop down, back up. Now we're moving on to more of a ballistic stretch, really letting our body weight and gravity put a lot of tension very quickly throughout that tendon there. Whenever our body gets used to this is no longer challenging. Our symptoms are telling us to progress it further. Don't go to one leg first, still on both legs. Start from a little bit more of an elevated position, drop down, slowly back up. Down, slowly back up. These are also 30 repetitions 3 times a day. Over time, you're going to elevate as much as you can. Drop down from there, slowly back up. Drop down from there, slowly back up. Progressing from there, you're going to go back to your 1 foot again. Back to that neutral spot, drop, slowly back up. Neutral, drop, slowly back up. And again, as our symptoms allow us to progress this further, a little bit more elevated, drop, slowly back up. A little elevated, drop, slowly back up, and taking it up higher and higher as our symptoms allow us to. So once we start getting to this part of it, our ballistic stretching, our ballistic exercise here, a lot of people, this is where we'll get off the train because we're not going to need to load up these tendons any further. We can stick with this over a long-term plan to keep these nice and healthy and ensure that we don't injure these any further. But for our athletes, our runners, anybody who's going to be using these further, we got to progress it along a little bit more. We can start off by doing some ankle hops on both sides here, just jumping up and down, using our ankles mainly only, barely bending those knees, loading that up right there. We can work on jogging in place. Progressing from there, we can start going into more of our sprinting, trying to take off with each foot as our plant foot to start off with. We can work on our slow downs as well once we're up to a full speed, trying to stop a little bit quicker and quicker. We can start working on our cutting drills as well too. And all the while, we're following our Goldilocks zone. We listen to our body. It'll always tell us if we're doing a little too much, if we're not doing enough, or if we're right there, right where we need to be. And just remember also, no 2 people are gonna heal at the same rate. So make sure that you're listening to your body and nobody else's as you're progressing it along throughout these exercises. So I have a few more videos left in our ankle series, so make sure you stay tuned for those. Again, I'm Dr. Mike Matthews with the PT 411. Thanks for joining me.